We all come from families. Our families are an important part of who we are and can be our biggest source of support and guidance. As an educator, it is important to understand family dynamics and how they are impacted across the lifespan when there is a child with a disability. There has been quite a bit of research on the topic of families. The purpose of studying family issues throughout the life cycle is to heighten the awareness and consciousness of the class regarding what families experience. There are two dangers that the literature on this topic has suggested we should be aware of. First of all, repeatedly discussing families as a group seems to draw attention away from the uniqueness of families. The second danger is that family adjustment literature rarely emphasizes the contributions of the person with a disability to a family. The focus is generally on critical periods and critical issues. It is important for us to remember that some of the most important people in our lives are our family members. When we are talking about children with disabilities, we must keep in mind that these children are somebody's sons, daughters, brothers, sisters, and grandchildren. They bring joy and are valuable members of the family system. In the following slides, we are going to talk about different stages of life, from pre-birth through adulthood. Prior to birth, there are some families that confront the possibility that their child may be born with a disability. Before conception, there is genetic counseling, and couples can determine what the possibilities are that they will have a child with a disability. For example, Tay-Sachs disease is an autosomal recessive condition. Parents can go through genetic testing to see if they are carriers of the disease and what the likelihood of passing it on to their child would be. Other genetic tests conducted during the pre-birth phase include the Down syndrome blood test, chronic villus sampling, and amniocentesis. The reliability of the test results is an area of consideration, and we will touch on this shortly. Chronic villus sampling involves actually snipping a piece of the wad as the forerunner to the placenta and then using the genetic information from this biopsy to determine if the presence of a disability exists. There is some controversy about chronic villus sampling because there is some evidence that the procedure puts the child at risk for other types of disabilities. Doctors do not necessarily recommend this test as a result. The more common procedure is called amniocentesis. The disadvantage of an amniocentesis is that it has to be done a little bit later in the pregnancy. Amniocentesis involves removing amniotic fluid to determine chromosomal abnormalities and other conditions. The amniocentesis is very accurate, however, results may not always be accurate, and there is a question as to what parents will do with the information once they have it. The introduction of a new child to the family can bring about a great deal of stress. Routines change, sleep patterns change, there is a dependent member in the household, and friends may even change. The stress associated with this stage may be especially pronounced for parents of children with disabilities, especially if the child is in need of medical technology or requires an extended period of time in the hospital. Children who are identified this young as having a disability tend to have very significant disabilities. Families do not expect their child to have a disability, and these things are not discussed during birthing class. Even in cases where there was a prenatal diagnosis, parents report that they often believed the diagnosis was wrong or that things would work out okay. The reality is having a child with a disability doesn't set in until the child is born. It is important to note that as a result of the heightened stress, babies with disabilities are often at greater risk for abuse. Wigler's stress adaptation model fits in well here. This model helps conceptualize a family's reaction and adaptation to a stress event by considering the family's event, resources, and perceptions with regard to crisis. If we apply this model to having a child with a disability, the diagnosis would be considered the stress event. According to Wigler, there are going to be two major influences on the extent to which the family experiences a crisis: the family's resources and the family's perception of the situation. Those working with the family will have a better understanding of the extent of crisis when they consider the resources available, along with the perception of the situation. All families with a child with a disability will experience a crisis event related to the child's disability to some extent, but it will be strongly influenced by these two factors. Another theory that assists educators in conceptualizing parental reaction to disability is the stage model of parental reaction to disability suggested by Sullivan and Darling. Based on this model, the first stage that parents experience includes shock, denial, and grief or depression. They hear that something is wrong with their child and they are in a state of disbelief. The most common reaction for parents that find out at birth that their child has a disability is intense sadness. Then the next stage includes adaptation. This is where the parents come to terms with the situation and they begin to understand the disability. Reorganization is the final stage, and it involves long-term acceptance of the child and incorporation of the child into the family's routine. Newer research on parental reaction to disability disproves that parents go through these stages and are able to move on. It is now clear that these stages are not ones that you just get through and then never return to again. It is a cyclical process, and parents may encounter these same feelings over and over. The early childhood years bring a new set of needs and issues. When children are very young, parents are especially interested in accessing accurate information. They want information about the disability and what the child should be learning. Lending libraries that offer information that parents can borrow and consult when they have questions are a great idea. An important caveat is that we need to watch the use of jargon in the information we provide. Parents in the early childhood years also tend to enjoy meeting and talking with other parents. Providing information on or organizing support groups is another great idea. Parents are also very interested in locating the very best services. It is not unusual for a family to move in order to access better services, which may stem from commitment and guilt issues. This can begin to affect the health of the family if the parents become too child-centered. The final issue we want to highlight for parents with young children is that there is a lot of concern for the future. Parents become keenly aware of the prolonged transition that the child experiences between milestones. These delayed milestones cause parents to worry about what the child will be able to do later on in life and whether they will have the strength and resources to provide for the child when the child gets older. What happens in the family setting when the child reaches school age? Take a minute to reflect on the laws and histories we have discussed in earlier modules. There are a host of new issues and topics that come into play when a child reaches school age. Just as when a child is diagnosed with a disability at birth or during the early childhood years, families go through the same adjustment challenges when a diagnosis is made during the school age years. That is, it can be just as devastating to the family to hear that their child has a disability during the school years as it is for a family to hear that their child has a disability at birth. Today, parents and children are moving from an early childhood special education system that almost demands parent involvement to a system that is traditionally very program and system-centered. However, with the addition of parent participation in IDEA and other legislation, parents may be asked to make decisions regarding their child's educational programming. Oftentimes, educators are supportive and accepting of the family's decisions, although there are still instances where the school and the parents disagree on educational decisions and find it difficult to come to consensus regarding how best to meet the child's needs. We would also like to note here that some school systems in Illinois offer a continuum of placement options. This means there are a number of educational placement options for students with disabilities. There are still some schools, though, that rely heavily on one method or another. Regardless, the point to remember is that making educational decisions for the child becomes a big focus of parenting a child during the childhood years. The educational system has made great gains in terms of special education for students with disabilities. However, there may still be a great deal of stigma attached to families of children receiving special education services. Sometimes the stigma is even more pronounced for children with mild or invisible disabilities versus more visible ones. Parents of children with disabilities are often faced with deciding how much information to disclose and whether disclosing any information will further increase the stigma. The final school-age issue is related to social opportunities for the child. Children without disabilities tend to spend increasingly greater amounts of time with themselves or with other peers as they grow older. Children with disabilities are far more socially isolated. They are also more vulnerable to being exploited, and they may not have the same social opportunities. Oftentimes, the family may need to fill the need for the child in terms of social experiences. The bottom line is that as children with special needs get older, they tend to not have as many social opportunities. Parents are forced to deal with arranging opportunities for social experiences, which adds yet another layer of stress.